friends. Welcome to our YouTube channel for Psychiatry Education Forum Academy. I am Dr. Harvinder Singh,
I am Dr. Satinder Kaur.
and we are the creator of Psychiatry Education Forum Academy. So, the video that you will watch right now is a very short clip from one of the chapters of the Academy so that you can get an insight as to what we do in our Academy. So, please watch it, and we will see you at the end of this video lecture. The next step now is understanding the medical complication. So the list is very, very long. I will divide them into various sections to make it easy for everyone. Mainly, these medical complications are related to the weight loss, malnutrition, and conditions attributable to purging, right? So let's start with the self induced vomiting complications first. So, a person who is engaging in self induced vomiting may have their salivary gland hypertrophy and include that in your physical exam, and we'll talk about that in few minutes as well. And they will have elevated amylase level. We'll talk about this in the laboratory evaluation as well. And they may have a delayed gastric emptying, postprandial fullness, and bloating. Moving on to a cardiovascular side complications. Now, this includes bradycardia, which can be severe if the heart rate slows further during sleep. So, monitor for that. And then risk of orthostatic hypotension and QTC prolongation with arrhythmias. This can happen. And then moving on to the binge eating. So, we talked about self induced vomiting on top, right? What can binge eating does in terms of complications? So this can be associated with gastric dilation that can even result in rupture. That's an emergency, right? But rarely the vomiting can also result in the esophageal rupture as well. So keep an eye on that. And then there is bone marrow side effects, which can include patients developing changes in their hemoglobin and the white cell counts reduction with a relative sparing of lymphocytes. And they say the bone marrow may become atrophic. So, when you do that complete blood count, you can catch many of those symptoms here. So, we talked about hemoglobin and white cell count, right, going lower. Same thing can happen with the platelet count due to the atrophy aspect. Now, with the kidneys, really important in the laboratory evaluation. So, the impact on kidneys include that the GFR, glomerular filtration rate, can decline, commonly or more commonly seen in patients with binge eating purging subtype. So, if you see that, focus on those kidney labs really closely. And then there is a risk of chronic volume depletion and hypokalemia, right? Due to the depletion, you see potassium going down as well. Now, the other things you can see in terms of complication is in the reduced muscle mass and the effect on the bones with osteoporosis, with the calcium and everything getting affected as well, vitamin D. We'll talk about osteoporosis management in the end, in the last one. So these are like basic summary. The reason I will talk about each of them moving forward in labs and other things, but it's really important to have everything in one slide so that you can focus on during evaluation.
Thank you for watching this video. If you find it clinically relevant, please join our Academy membership.
And please note, this membership is only for medical professionals so that you all can stay clinically updated. Please go to psychiatryeducationforum.com to learn more. I hope We will see you there soon. You all take care and bye for now. Thank you.
Bye for now. Thank you.